students, welcome to the next session of the pharmacology series. So in succession to the topics what I have discussed in the previous videos on pharmacology, moving on to the drugs which are used in the blood coagulation or the drugs which affect the blood coagulation. So today I'll be discussing about the two very important anticoagulant drugs, that is heparin and warfarin. So before I'll be discussing today, it is the important differences between heparin and warfarin, which are the most commonly used anticoagulants. So while before discussing them, just a short review as to what are actually heparin and warfarin and in what all medical conditions these drugs are used. So heparin and warfarin both are the medications that are called as anticoagulants. So that is, they help in the thinning of the blood to prevent blood clots. So the important medical conditions where heparin and warfarin are used, they are used in the treatment of myocardial infarction, the pulmonary embolism, the deep vein thrombosis, unstable angina, that is in chest pain, and in atrial fibrillation. So students, the another drug, that is the warfarin, it is also an very important anticoagulant medication, but it is taken as a pill. So warfarin, it is an anticoagulant that prevents blood clots and it is mostly taken orally. So the important uses of a warfarin also can be looked upon in the form of the medical conditions what are you in which it is used is myocardial infarction, thromboembolism, stroke, transient ischemic attacks, in prophylaxis of pulmonary embolism, and in the long-term treatment of atrial fibrillation, that is in heart arrhythmias. So these are the two basic important drugs which are used as anticoagulants in anticoagulant drugs, that is heparin and warfarin. So more or less the heparin and warfarin, they are used in the similar medical conditions, but there are certain striking differences between heparin and warfarin. So students, the first important point of differentiation between heparin and warfarin is that heparin, it affects the intrinsic pathway of the blood coagulation. So the intrinsic mechanism of blood coagulation, the heparin, it acts by affecting the intrinsic pathway. Whereas moving on to the warfarin, so warfarin, it affects the extrinsic pathway of blood coagulation. Moving on to the route of administration. So heparin, the is used mostly by intravenous IV route or by the subcutaneous route or the SC route. So the heparin, it is mostly given intravenously or subcutaneously. That is, it is mostly administered to those patients who are admitted in the hospital or the inpatients. Whereas the warfarin, it is the drug of choice which is used mostly orally. That is, it is given in the form of pills. So it can be used in the patients who are outpatients. All right. So the patients can be given warfarin therapy even when they are at home. Moving on to the third very important point of differentiation, that heparin does not cross the placenta. That is, it is not going to have a teratogenic effect, whereas the warfarin, it crosses the placenta. It is having a teratogenic effect. Moving on to the onset of action. So heparin, if it is as we have already seen, that heparin is mostly given in inpatients or the patients who are admitted to the hospital. So heparin is going to have a rapid onset of action, whereas the warfarin is going to have a slow onset of action. That is, it may take several days for the warfarin to elicit its action. Moving on to the next very important point of differentiation, that is the heparin is going to have a very fewer drug interactions, whereas warfarin, it says having many drug interactions are seen in case of warfarin. Moving on to the next important point of differentiation, that is the elimination of the drugs. So heparin, it is mostly eliminated by the renal route. That is, it is eliminated renally, whereas the warfarin, it is eliminated hepatically. So students, whenever any drug is administered in dosage of excess, there are certain antidotes which are given to prevent their abnormal higher doses. So the antidote in case of heparin, it is the drug of choice. The as antidote in case of heparin excess administered, it is the protamine, whereas in the case of warfarin, the antidote what is given, it is the phytomenadione, that is vitamin K. So students, this was a quick review and the quick point of differentiation between the two very most commonly used, the widely used, the two anticoagulants, that is the blood thinners, between heparin and warfarin. So students, if you do like my video, don't forget to subscribe my channel and do press the bell icon so that you can be further updated about the upcoming videos. Thank you for watching.